Today I would like to talk about the catheter location during electrophysiological study. Typically in EPS we use between 2 and 4 catheters. With no doubts, 2 of the most crucial catheters should be located. One in right ventricle and the second one in the coronary sinus. Very helpful is to use decapolar catheter, so the catheter with 10 rings which will be placed in the coronary sinus. High number of intracardiac leads from this catheter may show us direction of left atrium depolarization during the arrhythmia. And typical numeration of rings in multipolar catheters is starting from the most distal part of the catheter. So the arrhythmias which come from the left side of left atrium, in this case the earliest depolarization should be registered by the most distal rings. In specific conditions, we may use additional catheters. Beside the catheters in right ventricle and coronary sinus, the next important catheter, which potentially may be useful, is the catheter placed in the area of bundle of His. With this catheter, we may differentiate between proximal and distal conduction disorders in atrioventricular node, and properly located catheter should register first of all the atrial activation, the ventricular activation, which is typically with higher amplitude than the atrial activation, and small sharp potential, which is the potential of bundle of His. It's also worth to remember when we place the catheter, or we want to place the catheter in the area of bundle of His, that these three parts, so the atrial potential, ventricular potential, and potential of bundle of His, is crucial to be sure that we locate the catheter in the right position. For example, if we are too deep, we may observe intracardiac electrograms which looks like this. So we observe the high amplitude of the ventricular signal and the other amplitude, which in this case is not the electrogram of bundle of His, but by rather the signal from the heart conduction system, for example fascicle or other part of this heart conduction system. Another potentially useful location of the catheter during electrophysiological study is high right atrium. Using this catheter for pacing, we may determine sinus node recovery time because we are quite close to the physiological placement of the sinus node, which is in higher part of the right atrium, between the right atrium and superior vena cava. What's more, we may use this catheter, which is located in the high right atrium, for example, when we want to pace in patients with the septal accessory pathway. It's in this case, if we've got the septal accessory pathway, it's worth to pace from other region which is not very close to the accessory pathway, because if we are too close to the accessory pathway, sometimes the artifact from the pacing may cause that the atrial and sometimes even the ventricular activation may be hidden. Presented locations of catheters are the most typical, but it's worth to remember that sometimes during the pacing maneuvers their locations may be changed. What's also important, not the number of the catheters, but the proper location and ability to analyze the register electrograms are the most important during the electrophysiological study.